Hemostasis has reference to the arrest of bleeding. 3 mechanisms. Okay. Vascular constriction. All right, that means that there's just a response triggered from the spinal cord, a little bit of constriction. Doesn't do much. Now, if you cut the radial artery, now here's what I want to emphasize to y'all. I want to emphasize this. If the radial artery is cut, or if the aorta explodes, or if the carotid artery is cut, none of these clotting factors mean doodly squat. They don't mean doodly squat. Because that blood is coming out so fast that nothing will work. Okay, that's like Alfred Sidney Johnson with a popliteal artery. The only thing that would have worked on him was a tourniquet or pressing to stop the blood flow. All right, so vascular constriction. The next one of these things is platelet plug formation. That's where aspirin come in. They had 81 milligram aspirin either once a day or twice a day. That's where that comes in. The platelet plug, which we'll go over. And coagulation. The most complex of these now is that third one. It involves 2 factors. Now, this is what you need to kind of be working on. Kind of be working on. Okay, kind of be working on this one. I think. Well, now let me go on with this just a little bit. First one of these vascular constriction, no big deal. Smooth muscle contraction, pain reflexes involving the spinal cord, chemicals such as thromboxanes released from damaged platelets. That's no big deal. Vascular constriction, we'll come back to these thromboxanes in a few minutes. But vascular constriction just means that smooth muscle constriction. But again, if a big vessel is cut, like the radial artery, when people commit suicide, they slight cut their wrist. They cut their wrist, you know. There's got to be an easier way to go. But slice the wrist, the blood just goes. Person just starts getting weak. Weak. You know, the cardiac output's going to go down and start get weak and just go out. All right, but anyway, that's vascular. Now, right here, everybody, this may reduce blood flow. It might work a little bit of vascular constriction. Now, this one now, a little more serious, platelet plug formation. Now, here's what you need to remember. You need to implant in your brain ARA. All right, ARA. All right, steps and follows. Adhesion. Adhesion, platelet adhesion. R stands for release, and the ARA, the last A stands for aggregation. All right, now watch this. Occurs when platelets bind to collagen that is exposed as a result of blood vessel damage. In other words, when blood vessels are damaged, collagen is exposed, platelets bind too. All right, now the platelet adhesion to what? Adhesion to the collagen. All right, now have you ever heard of anybody having the von Willebrand disease? You ever heard of that? Von Willebrand? Von Willebrand, that's a good German name. Nobody's ever heard of von Willebrand disease? All right, look at this. Mediated via the von Willebrand factor. Now that's on your practice exam 3. Look at your practice exam. You will find von Willebrand mentioned. Von Willebrand. That's on the practice exam. Von Willebrand, and it'll be on the major exam too. Von Willebrand. All right, what is the von Willebrand? Platelet adhesion is mediated by via von Willebrand factor, a protein produced by endothelial cells. It's written like this: the little VWF, von Willebrand, forms a bridge between the collagen and the platelet. Now look at this. Von Willebrand disease, and I've had a student in here said her mother or daddy, somebody, had von Willebrand, the von Willebrand disease. I've had a student before with that. It's not a real bad type of bleeder's disease, but it is a type of bleeder's disease, the von Willebrand. Von Willebrand is an autosomal, that means not sex chromosome, an autosomal dominant hereditary disease. Most common inherited bleeding disease is von Willebrand. Occurs as frequently as in 1 in 1,000 individuals. Von Willebrand. You can Google von Willebrand. Right here, platelet release reaction. Platelets become activated and bind to the collagen. In other words, platelet adhesion via von Willebrand, adhesion, release, and they release ADP and thromboxanes. Now we're getting into what aspirin does. Aspirin interferes with the prostaglandin necessary to produce the thromboxanes. And the aspirin interferes with that. It interferes with it, and this platelet plug will not occur. Now you got to read about this. I want you to read about this between now and next time. It's almost time to go, but let me show you one thing. Let me show you one thing. These chemicals cause platelets. Aspirin interferes with this. There it is. And then there's a platelet aggregation. Now, right here, I'm going to show you something. I'm going to start with this next time. There's the von Willebrand stuff right there. The von Willebrand, look at this, everybody. The von Willebrand is a protein. Remember, as many as 1 in 1,000 people can lack this. The von Willebrand factor causes platelets. And we'll go on with this next time. Here's what if I were you, I would do. Between now and next time, I would read over, if you have a source to read, I would, your notes, for one thing, read over this blood clotting. Because this is the only part that will kick your rear. Rather, the rest of this stuff is not too hard. And this is not hard, but it's kind of tricky. So you're going to have to study the blood clotting. Okay, so we'll be doing it next